with that being said, we'll go ahead and begin. It's 2:26 now. So good afternoon, and thank you for joining the Linkages Screening Tool Workshop. This session will introduce a draft screening tool designed to identify CalWORKs applicants who could benefit from early supports to reduce risk of child maltreatment. We will also share ideas for using the tool with broader populations and share what we learned from a pilot of the tool in 2 California counties. Next slide. Thank you. Today, you will hear from our Child and Family Policy Institute Director Emeritus, Stuart Oppenheim, myself, Andrea Lewis, Linkages Senior Program Associate, and Sophia Jeffe, our Prevention Associate. I'm now going to transition to Stuart, and he'll begin to discuss our workshop goals and provide a bit of background related to the screening tool.
Okay, thank you. And again, as Andrea said, we're really going to talk about in addition to what's on the screen, I'm going to talk a little bit about how we got to the tool in our linkages work group process. Then we're going to talk about a little bit about the development of the tool, and then share the tool, share what we've learned from a pilot, thanks to some of the counties that have participated, and some are here. And then share ideas about how the tool can be used with a broader population, because we think it's an extremely valuable tool. So with that, why don't we go to the next slide? And I'm going to start with a little bit, not the narrative that's on the slide necessarily, but let me tell you a little bit about linkages if you're not a linkages county. We're sort of used to having conversations about linkages in the human services arena, with a capital H, the public human service agencies, but we know that many of you may not be all that familiar with linkages. So the linkages work goes back to the year 2000. So we've been doing this in various ways for the last 26 years. Not us personally. Well, actually, I've been involved for the last 26 years. But anyway, and Andrea's dropping in the chat a link to our website where you can learn a lot more about linkages than I'm going to tell you. But basically, linkages originally was very much focused on what we call high-end clients, folks that are participants in the CalWORKs Welfare to Work program and the child welfare case program, not people who are referred to child welfare, but people who are referred and then accepted as cases. So much of the early work in linkages for the first couple of decades actually was focused on coordinating case plans for welfare to work families and child welfare families who were either in the family maintenance or the court system. So very much the high-end families. Linkages went through a number of iterations over the years, from a state-funded program, a foundation-funded program, to a federal grant-funded program, to a state-funded program, to a county-supported program, and over the years. And then in 2016, that funding sort of ran out, and counties were left to do it on their own. In 2019, the state of California, working with the federal government, decided to reinvigorate linkages, and it was our Office of Child Abuse Prevention folks at the California Department of Social Services who revived linkages, and in doing so really wanted to think about how could we take a more prevention-oriented approach with linkages. So rather than just focusing on the families who are high-end in both programs, how could we begin to look at different ways to support linkages as a prevention program, which is a kind of why we're here today. And we created a prevention and early intervention committee. I see some of our participants in that committee here today, who could probably do as good a job as I can in describing what that was about, but I'll go ahead and do it because I have the floor. Anyway, so we thought, what would linkages prevention and early intervention look like? So linkages was following a prevention framework set out by the Office of Child Abuse Prevention, of primary prevention, secondary prevention, and tertiary prevention. So tertiary is really those high-end cases that I was talking about before, Primary prevention, I think you all probably are aware of the prevention framework, really is focusing on the population at large. So if we think about in a linkages context where we're coordinating benefits programs with child welfare programs, the benefits program, the population at large would be anybody who's applying for or receiving CalWORKs um, services, irrespective of whether they've identified risk factors or not. Could we reach out to everybody in that population as a primary prevention population? Not reaching out to everybody in the community, but everybody in the benefits applicant and recipient population. And then we thought, well, how can we address those folks? What can we do for them? So we developed a brochure, a, um, that would identify ways that families could self-identify. Do you have any of these issues that you might be working with? And then can we direct you to resources? So really an informational process. Here are resources based on protective factors. And, if you identify that you have those issues, and then I think Andrea is sharing the brochure in the chat. So you can see it's sort of a universal informing, and it could go in public benefit offices. It could also go to doctor's offices, community healthcare offices. It really is just helping people identify, and it's tailored for each county. So in your county, you can put in your resources that follow each of those protective factors. So that's kind of how we did. We thought, well, that's how we'll approach a sort of a universal prevention, primary prevention approach. But then when we got to the secondary prevention, well, what are the populations where, if you know secondary prevention, it's really focusing services on um, families who do have identified risk factors or can identify those risk factors, and then getting those families to services. So we thought about looking at again the CalWORKs population. There are a lot of ways of screening and identifying services for families if they're in the Welfare to Work program. So if you don't know CalWORKs, you come in, you get identified for benefits. A certain percentage of families get to CalWORKs. They get an online comprehensive assessment tool that directs them to services. But we found that only 30 to 40% of CalWORKs applicants actually get to that phase of CalWORKs. So what about the other 65 to 70%? How can we help them identify um, what their needs might be and what their resources might be? So we set off to um, figure out, could we establish a screening tool that could be used earlier in their experience before, instead of going to the OCAT for that percentage, but for everybody applying for receiving benefits. So we looked around. We had a subcommittee that was working on identifying possible screening tools. We thought, well, there must be one out there. Somebody must have developed something for public benefits recipients to help them identify risk factors and resources, and we found out there wasn't anyone out there. There wasn't a tool out there, so I think Derek Salama is on the here, and he could raise his hand and say, Derek really led the effort of, well, if we're not going to find a tool out there, let's develop one ourselves. So, having identified the need, we developed the tool through an extensive collaborative process led by Derek and others of our linkages partners, county leaders, community-based organizations, and individuals with lived experience. Um, Again, found there were no existing tools, so set off on a process of development that included surveys, focus groups to ensure that the tool was culturally responsive, concise, and actionable. We had two implementation options emerge to support county flexibility. That the tool could be self-administered using a kiosk, iPad, or QR code, or completed with staff as a guided conversation and warm handoff to services. And if you're involved at all in the Transforming CalWORKs work, you know that they're going through a similar process of trying to identify both a self-administered or staff-supported administered process. We think that we kind of led the way and can give some good ideas about how that process might develop. So the group developed design elements that drew on promising practices from other states, other tools, emphasizing the strength-based framing, simple check boxes, and a clear pathways to um, steps and referrals to services. So again, just to recap, Linkages 1.0 was very much deep end. Linkages 2.0 is all about prevention and early intervention. We've done some primary prevention work. Today, we're going to talk about that secondary prevention work. How do we help families with risk factors, identify what those factors are, and get them to services? So, with that, I'm going to turn it over to Andrea, who's going to tell us about the tool itself.
So Stuart gave you guys a lot of insight into how the tool came about, how it was created. Yes, thank you, Derek Slama, Prevention Director, is wonderful, with some help from Nkechi. So thank you for that. And as Stuart mentioned, and according to the LAO, which you may have heard today or sometime this year, because we are on fire about this population. But about 55% of CalWORKs families include no adult recipients because parents are excluded due to immigration status, SSI receipt, time limit exhaustion, or other eligibility rules. These families do not receive family stabilization or welfare to work services, even though they often experience significant economic and caregiving stress. Exemption from welfare to work requirements does not mean low need. It usually reflects complex circumstances that increase risk. Many families who could benefit from barrier removal or stabilization supports are never assessed at all, especially those affected by immigration exclusions, non-needy caregiver status, or SSI linked ineligibility. As a result, roughly half of families receive neither grants nor work related services despite having substantial needs. Key drivers of ineligibility include immigration status, non-needy relative caregiving, SSI receipt, disability, very young children, and time limit exhaustion, all of which leave families visible to systems but underserved by eligibility structures. This screening tool gives counties a way to identify needs earlier, strengthen prevention efforts aligned with Transforming CalWORKs and FFPS, and improve coordination across public benefits, community partners, and prevention services. It helps close service gaps, assess strengths and needs, and generates meaningful data to improve service arrays, identify program gaps, and connect families to the right supports at the right time. Thank you. So, the purpose of the tool. Early community-based intervention gives counties a chance to support families before stress escalates into crises. By identifying needs early, we can connect families to voluntary, non-stigmatizing supports that address root causes, stabilize households, and reduce the likelihood of child welfare involvement. This approach aligns with Family First and other prevention-focused strategies that emphasize upstream support rather than reactive responses. CalWORKs intake is a critical touch point. Families are already engaging with systems, making it a moment of opportunity rather than crisis. A screening tool helps counties act on that opportunity by spotting needs sooner, linking families to community-based services, and strengthening prevention across the system. As we developed this tool, we were intentional about limiting intrusion into families' lives while still capturing the key needs that matter most. The tool is designed to identify strengths and needs early, helping counties detect economic safety and well-being challenges before they escalate. It supports prevention efforts by linking families to FFPS and other community-based services, and it facilitates service coordination by bridging CalWORKs, FFPS, and community partners for families who touch multiple systems. We also focused on equity and accessibility, ensuring the tool can be used across diverse languages, cultures, and literacy levels. By connecting families to the right supports, the tool aims to enhance outcomes, improving safety, stability, and economic well-being. It streamlines decision-making by offering consistent, actionable insights, and it allows for independent completion, empowering families to use a simple, self-service option while still enabling staff-assisted support when needed. Finally, the tool helps inform system-wide improvements by generating meaningful data that counties can use to strengthen prevention strategies and refine practice over time. I'll now transition over to Sophia, who will walk us through the key elements of the tool.
Thank you, Andrea. So building upon the goals that Andrea just shared, we worked to identify several core elements that would shape how the Linkages Family Needs Screening Tool functions in practice. So first, we wanted the tool to function as a needs assessment that was grounded in evidence-based questions that target key areas of family well-being. This includes areas of economic stability, such as housing, employment, and income supports. It also includes family safety and overall well-being, including potential risks of maltreatment and family stressors. We also looked at access to critical resources like childcare, transportation, and healthcare. And we incorporated protective factors, including parental resilience and social connections, so that the tool reflects both strengths and needs. We also prioritized strong alignment with prevention efforts and the broader goals of linkages. The questions in the tool were designed to help identify mutual clients across CalWORKs and child welfare services. The data collected is also intended to support both prevention and service coordination, and we included questions that may contribute to candidacy determination for the Family First FFPS Title 4E funded prevention services. Finally, within the core components, we wanted to ensure that counties had the ability to customize the tool to reflect local needs, workflows, and service environments, while also maintaining somewhat of a consistent overall structure. In terms of accessibility, the tool supports both self-service and staff-assisted use. So families can complete the screening tool independently through kiosks, online portals, or mobile applications. There's also a desk-assisted option so that staff can guide families through the process when additional support is helpful. Looking at accessibility, we built in language accessibility framework to support multilingual use. This includes a structure that accommodates translation into multiple languages, simple and universally understandable base language, and visual support such as icons or color coding to assist users with lower literacy. We also centered inclusivity and cultural sensitivity. So the questions were designed with cultural humility in mind to reduce both bias and stigmatization. And like we've mentioned earlier, diverse stakeholders contributed input during the development to ensure that the tool is relevant across varied communities in our state. From a usability standpoint, the interface is designed to be intuitive and easy to follow. This includes a simple layout, progress indicators, clear instructions, and skip logic so that families aren't being asked irrelevant questions. Privacy and security were also very important considerations in the process. Where possible, we made sure that data can be anonymized to protect sensitive information, and secure transmission and storage protocols are built into the design itself. And then finally, the tool includes interactive features that help families understand the purpose of the screening. This includes clear expectations for why certain questions are being asked, as well as potential recommendations or next steps after completion, such as being connected to a specific resource based on their specific responses. So together, these elements were intended to create a screening tool that is practical for counties, accessible for families, and aligned with prevention-focused service coordination across systems. We can go to the next slide. Thank you. I want to briefly walk through how the Linkages Family Needs Screening Tool supports integration and reporting, starting with streamlined data collection. So the tool itself was designed to support streamlined data collection for sharing and for follow-ups so that information entered once can inform next steps without needing to be recollected throughout the process. Real-time data entry also helps avoid duplication of efforts and supports more timely coordination between families and staff. From there, the tool supports customizable reporting that is meaningful at both the county and statewide level. For counties, they're able to generate county-specific reports that support localized decision-making, planning, and service alignment. At the same time, the aggregated data can be used to identify broader trends that inform statewide analysis, continuous improvement, and prevention system strengthening. The tool also includes space for feedback and ongoing iteration. Families and staff have the option to share feedback and usability relevance, which creates an opportunity to learn directly from implementation and make adjustments that are grounded in real families' experiences. Finally, the tool itself was built with scalability in mind. It has a modular design that allows for future updates, such as adding new risk factors or protective elements so that the tool can evolve alongside county needs while maintaining consistency in data collection, reporting, and prevention planning. And I'll pause there while we transition to the next slide. Great. So once we identified our goals and key elements, we moved through a structured 3-phase process to develop the Linkages Family Needs Screening Tool. We began with a landscape scan of existing screening tools, like we mentioned earlier, to understand what is already being used across systems, where there are gaps, and what practices could inform a more integrated approach across CalWORKs and child welfare prevention. From there, we centered constituent engagement. This included collaboration with lived experts, representatives from CalWORKs and child welfare services, and county-level practitioners to identify key screening objectives, data needs, and operational constraints. We also engaged community organizations and advocates serving non-English speaking populations to help ensure that the tool reflects cultural and linguistic inclusivity. The final phase focused on content development and implementation strategy. This included developing a framework for language accessibility that is trauma-informed, family-friendly, and easy to understand, while also allowing counties to support multiple languages without needing to create an entirely new screening tool. This design includes placeholders for translation and adaptable interfaces that support multilingual deployment. The tool itself was structured to assess key areas of need and risk aligned with both CalWORKs and Family First prevention priorities, using evidence-based questions that are connected to the protective factors and overall goals of the Linkages project. At the same time, we made sure that counties retain the flexibility to adapt the tool to local priorities while maintaining a consistent core framework. We also explored access and usability. So like I mentioned earlier, this includes that self-service option that families can reach through online portals, kiosks, or mobile applications, along with straightforward navigation features such as skip logic, drop-down menus, etc. And again, privacy and security were built in to protect sensitive information, allowing counties to have the option to use the screening data to help improve their service array and practices so that families can be connected to the right supports as early as possible. Now I'll pass it over to Andrea to walk through the pilot process.
The pilot process, right? After all that background, after all the building, um, we got to the pilot. And so, as a part of the piloting process, we began by selecting a diverse group of counties that reflected variations in size, demographics, and language needs, including both counties with strong linkages histories and those newer to the initiative. Ultimately, we began the pilot with both Napa and Placer counties. These counties received training and orientation. Someone raised their hand. Can you put your question in chat? These counties receive training and orientation on both the self-service and facilitated versions of the tool, with guidance on adapting it locally while maintaining core standards. We will test the user experience with families from different demographic and linguistic backgrounds, using feedback from participants and county staff to refine usability, question clarity, and accessibility. Counties also helped assess the language and translation frameworks, offering insight into their practicality and effectiveness. Throughout the pilot, we evaluated outcomes by examining how well the tool identified needs and risks, facilitated service connections, and supported prevention efforts, while monitoring engagement and barriers to completion. Based on these findings, we performed refinements to the tool's design, language framework, and implementation processes to address gaps in accessibility, usability, and data collection. Next slide. So our timeline. We launched the pilot in August of 2025 with our kickoff meeting, and we finalized the web-based tool. In September, we held individual planning meetings with each pilot county to prepare for implementation. The pilot officially began in October of 2025, followed by weekly check-ins November through January to monitor progress and address emerging needs. We concluded the pilot in February of 2026 with a final meeting focused on qualitative learnings. March has been dedicated to analyzing the data and developing the findings report. And by April, we will finalize the report and begin outlining next steps for continued expansion. Effective pilot implementation required us to pay close attention to several key considerations that shape how the tool functions in real county environments. We focused on delivery, ensuring counties could integrate both the self-service and facilitated versions of the tool into their existing workflows. Cultural responsiveness was essential, guiding us to adapt language, examples, and supports so families from diverse backgrounds could engage meaningfully. We emphasized warm handoffs, making sure that when needs were identified, families were connected smoothly and respectively to the right services. Because eligibility rules vary widely, we also examined program eligibility to ensure the tool complemented, not conflicted with, CalWORKs, FFPS, and community-based service pathways. Counties received training to build confidence and consistency in how the tool is used, and we embedded continuous quality improvement so counties could refine practices based on real-time learning. We also considered system integration, exploring how the tool aligns with existing data systems and workflows. Finally, we prioritized accessibility, ensuring the tool is usable across languages, literacy levels, and technology access points so all families could benefit. Next slide. Thank you. So, some successes. Across both pilot counties, the tool proved most valuable in its ability to deliver immediate, relevant resources to families at the moment needs were identified. Families responded positively once they understood the tool's purpose and could see the tangible benefits of receiving timely supports. Staff preparation played a major role in this success. Consistent messaging, clear scripting, and thoughtful framing all helped build trust and improve engagement. The tool also strengthened prevention-oriented conversations, helping staff shift from compliance-focused interactions to supportive, strength-based discussions that highlighted existing community resources and reinforced families' resilience. Challenges. Across both counties, several challenges emerged during the pilot that will guide our next phase of refinement. Time pressures affected participation, with some families opting out early or completing only a part of the tool. There was also confusion about whether the tool was mandatory. which influenced how families engaged and contributed to inconsistent participation. Counties experienced platform limitations that made data access, follow-up, and tracking more difficult, often requiring staff to create workarounds to keep the process moving. Additionally, both counties raised concerns about managing large resource lists, noting that while families appreciated relevant supports, overly long lists risked overwhelming them and reducing the usefulness of the tool. These challenges highlight important areas for improvement as we continue strengthening the tool and expanding the pilot. And then, lessons learned. The pilot surfaced several important lessons that will guide how we strengthen and scale the tool moving forward. Counties found that the tool works best when it is clearly positioned as a voluntary, supportive resource rather than an additional requirement, which helped families feel more comfortable engaging. We also learned that immediate access to relevant resources was far more motivating for families than completing the full questionnaire, reinforcing the value of quick, tangible benefits. Counties emphasize the need to build follow-up processes directly into the tool flow so staff are not burdened with manual tracking or additional steps. Finally, the pilot highlighted that counties benefit most from flexible, adaptable models, approaches that can be tailored to staffing realities, physical space constraints, and the unique needs of their communities. Next, Sophia will share the county-specific results, and we will have a chance to hear from the participating counties related to their processes and thoughts. Sophia?
Thank you, Andrea. Yeah, so as we looked at Napa's pilot results, one of the clearest takeaways was that the tool helped normalize prevention-oriented conversations and reinforced awareness of available resources in their county. Clear staff scripts and consistent messaging also played an important role in supporting this shift and helping families understand the overall purpose of the screening. At the same time, we saw that some families chose not to participate. In many cases, families were focused only on their immediate CalWORKs needs, or they believed that the screening was mandatory rather than voluntary. And this highlighted the importance, again, of clear voluntary framing and transparent communication about how the tool is being used. From the staff perspective, um, there were concerns about duplication with existing efforts, specifically around existing intake questions, along with broader workload considerations. We also learned that completing the screening at first contact can improve overall reach, but it needs to be prepared with realistic workload planning and clear messaging so that the process remains supportive rather than burdensome. Finally, we heard that the resource lists do need to be scalable and adaptable to local geography and population needs in order to remain effective. Now, taking a look at some of Placer's early implementation results, we saw that intentional outreach increased participation and helped normalize the screening tool as a supportive resource rather than an additional requirement. This reinforced the importance of how the tool is introduced and framed within everyday interactions with families. At the same time, the most common reason that families did not complete the screening tool was simply time constraints. This highlighted the need to design participation in ways that are flexible and responsive to families' immediate priorities and schedules. So to support that flexibility, implementation planning includes multiple participation modes. These included assisted completion with staff, self-administered options, QR code or take-home access, and paper versions when needed. Offering several pathways helps reduce barriers and allows families to engage in ways that feel most manageable. We also learned that privacy considerations must intentionally be built into the lobby-based workflow. There needs to be space created and processes that protect confidentiality for families to feel safe participating. Another key practice consideration is collecting warm handoff consent and contact information earlier in the screening process. Doing this upfront helps ensure that families will be connected to services even if the full screening isn't completed in that moment. Finally, implementation benefits from strong coaching and clear scripts for interns and staff. This includes guidance on responding to refusals, understanding reasons for early exit, and making sure follow-up options are clearly communicated so that families still have pathways to support. And all of these insights are helping guide us into a more responsive implementation moving forward. Slide. So we are very grateful to have some of our county partners here who participated in the pilot. For the next 10 minutes, we would like to hear directly from our pilot county partners about what it was like to implement the screening tool in practice. So we have joining us now Yvonne Contreras, Staff Services Analyst with Napa County, and Luz Flores, Employment Services Program Supervisor, sorry, tongue twister, and Stacy McNally, CalWORKs Program Manager, both of which are from Placer County. So we really hope that this conversation will help surface what implementation looked like in each county, what counties were hoping to strengthen through the pilot, and what stood out as they began using the tool with families and staff. So we'll make sure to spotlight you all. Just bear with me for 1 second.
Oh, Sophia, I'm sorry I pinned them.
Oh, no, that's okay. I'm in the spotlight then. Let's see. Alrighty. Well, thank you all so much for joining us. I'll allow you all to maybe introduce yourselves again if you'd like. But I think that our first question is for Placer County. And we are curious to know what gap or challenge you were trying to address when you decided to pilot the screening tool.
Those, do you want to jump in or you want me to?
You can start it.
Uh, so I mean, the gap we really were trying to close is we have a lot of resources. I think you saw already on the feedback that was shared that sometimes the problem is you have so many resources, but people don't necessarily know how to access them and don't really make the connection of what services go with which agency. And so we were really just trying to be able to do some warm handoffs and do some closer connection to get people attached to services. And we did ours a little different. Ours were not all CalWORKs customers, but just really looking at our population and seeing where can we close some of these gaps and get people connected to services. So really, it was just service connections to hopefully not see them hit our linkages group later on.
Yeah, I think that's it, is just making sure that those connections were being made for the resources and the customers. And so we put ourselves out in our lobbies to be able to offer those services to as many people as we could.
Thank you for that. Our next question is for you, Yvonne. In Napa County, how did you guys integrate the screening tool into your existing processes?
Hi, everybody. So we, just quick disclaimer before I answer the question, I am working from home. I have 4 cats. In case any of my special guests come on, I'm sorry. Sorry. But anyway, here in Napa County, we integrated the tool. We were trying to think of how best to make this as seamless as possible. We didn't want it to feel clunky or out of place because we already know here in Napa, we piloted it exclusively with our CalWORKs applicants. And we already know if people are applying for CalWORKs, as we've talked about earlier this morning, we think about the hierarchy of needs. They want things right now. And interrupting them or trying to interrupt the flow when they're already overwhelmed and seeking help, it can be a big ask for these folks. So we did our best to do it as part of the application process. Now here In Napa County, we do cold calling. So we try to do our intake interviews within the first day anyway. So what we do is when that person is calling to apply, which is the bulk of our applications, we were having it forwarded to somebody in our eligibility team to do the questionnaire and then continue on with the intake if they're available to do so in that moment. Those that were applying online, at the moment that we were doing the cold call to do the interview, then we would do the screening tool at that moment. And those folks that were coming in person, we were having them, asking our reception staff to provide our customers with a QR code to be able to do it there. And that was where when we started offering it, the QR code at the in-person services, that we noticed that we should probably have the survey in Spanish, but this is what the pilot was about. So that was how we implemented here at Napa.
Thank you so much for sharing, Yvonne. You know, you guys had a lot of great lessons learned that also helped support Placer's implementation as well, since they were a couple weeks behind you. Another question for you, Yvonne. How did families respond to the screening process?
It was a mixed bag. I'm sure, like it was new to us, just like it was new to them. Um, some of our CalWORKs folks are lots of people that reapply, and so some of our staff was met with, "Well, you didn't ask me these questions the last time," which was something for the eligibility workers to have to address. But overall, it had a pretty positive response. Some folks did ask, of course, if it was mandatory, and we didn't push it. If somebody was really hesitant to answer the questions, we did try to tell them, we're trying to help you more to be able to help you appropriately, to give you resources that you may not know about. And so people were more forthcoming to continue with the survey. But I would say one of our biggest surprises that we noticed is um, that some folks were saying, "No, I know about these resources. I went to them. I'm coming to you because I already went and accessed this resource." And I think that goes to show here in Napa on a bigger scale, we do biannual we call it What's Happening in Public Assistance, where we invite our community-based organizations and we talk about changes or the programs that we offer here at the county. So it just goes to show that the things that we're outreaching, things are actually working. We're making a big difference, and the folks in the community are aware of the services that are out there in the community. And that was just I call it the warm fuzzies. It really gave me the warm fuzzies to know that the people in the community do know about the help that is out there for them. So it was just a mixed bag, but that was a nice surprise.
No, that's great. Thank you so much for sharing, Yvonne. And I agree, it does elicit some warm fuzzies. My last question is for you, Stacy and Luce. What was the biggest lesson that you learned in Placer County that you wish you had known from the start?
I mean, I'll jump in. Um, I think we rely a lot on I saw a comment about 211 and stuff, and we use 211 here in Placer, but I think we have an assumption because we have like resource lists out, or there's 211, or there's information out there that we assume that people get connected to services. And I think what we saw, at least for us, is there are a lot of people who actually don't know about some of the resources. And I will say, I think that for us, because of the way we structured ours, again, I think I said we were not targeting the CalWORKs population. We were in our lobbies, so they could have been CalFresh or Medi-Cal. Um, many of the people who responded were not CalWORKs recipients. And we did have an intake worker, a CalWORKs intake worker doing it also. So there definitely was that population. But most of our responses were not that population. So for me, that told me CalWORKs is doing a phenomenal job at connecting people to services already. And maybe we need to start expanding what that looks like for some of our other populations that don't have quite the connection to a welfare to work counselor or some other services we offer. So that was just interesting to me because I don't think we ever think of it like that. Like we look at these services as being available to the county as a whole, but the handoff piece of that is really important and really does help people access services. And for me, I think that's maybe why we were seeing the responses we were, is those were a lot of individuals who don't have that hand-holding piece of it that we offer here in CalWORKs. So that's my response, Liz. I don't know if you have anything to add to that.
I'll add some answers to some of these questions that are popping up. The tool itself takes about 10 to 15 minutes, depending on how fast they go through the questions. Some people skip them and that kind of a thing. The one thing we used student interns as well as our eligibility folks to ask some of these questions. To go back to the question, I think that maybe getting them to also understand more about what the tool, its intent was. I think it would have been more of a taking more time for the training piece to help them understand how to connect that with the folks they were connecting with or talking to. I wish we'd have done that a little bit differently, just so they really understood, because we explained and it sounded like they understood, but they're different, right? Because they're not actual counselors or employees or eligibility staff. So they're going to have a different concept of what their interpretation of what their need is. So, but then at the end, they were getting it. And I'm not going to lie, QR code was the most popular piece that I saw. That was more people were taking that than anything else, because yeah, you're asking them to answer some questions. They're going through and they're going, I'll do it later. And they did. We did see the results and people were responding to them as well.
Thank you both for sharing. Yeah, that is very helpful context. And thank you for responding to those questions from the chat. I know you guys had a lot of success with your QR code as well. Just to add, I know you printed them out so that folks could take them. Whereas, I think in Napa, some of the structure that we used was you guys printed them out and then folks could scan it there, but you guys decided to move forward with printing them out for people to take home. I'm curious, I don't want to put you on the spot, Yvonne, but if you would feel comfortable sharing just really quickly before we wrap up about which workers you guys utilized in the screening tool process.
Well, as I shared in the chat, CalWORKs only has 4 eligibility workers, a lead and a soup. So it was just whoever was there that day, y'all. And so since we have 4 staff members, um, I like to say that my CalWORKs unit is a table. And when there's one leg missing on the table, sure, it's wobbling, but it's still up and we figure it out. We are a small but mighty team. So it was just all hands on deck.
Yeah, I think we got lucky. We do have a variety of folks. We have, and we did use, even up in Auburn, we were using some of our clerical staff maybe, and just
mostly student interns. We only have no, I think we have 5 CalWORKs intake staff now, Yvonne. So we're not too much higher, but we do have a really good student intern program we're working on. And so we've been able to utilize that group, and it's good for both parties. So, but I agree, like training is always key. And so definitely something, if anybody's considering something like that, is just considering that piece of it as you're going into, I think, I am much more like, let's just do it and we'll figure it out as we go along. But the staff always benefit from a little bit of forethought putting some thought into how we're gonna prep them for that and the whys behind it and what our goals are at the end. So.
Great. Thank you all so much for sharing. We really, really appreciate your participation in the pilot and both here today. For Melissa to pull up the slides. Great. So as we think about the post-pilot goals, one key focus is understanding whether families were actually able to access the resources that were provided through the screening and referral process. So this includes looking beyond the initial referral to see whether support was reachable, usable, and responsive to what families needed when they came in. That insight is going to help us guide future adjustments to both the resource connections and the overall screening approach. Another post-pilot priority is identifying families who may want to participate in a follow-up survey or focus group about their experience with the process, with the goal of obtaining direct feedback on what worked, what was challenging, and what could be improved moving forward. And with that, I will turn it to Andrea, who is going to guide us in a breakout activity using the tool itself. So thank you.
Thank you, Sophia, Yvonne, Luz, and Stacy. And like Sophia said, for being here today and for being a part of the Linkages pilot. We really appreciated you guys' participation, follow through, and feedback. So thank you very much for that. And it looks like there's a lot of interest in the chat. And so there's a comment that I want to respond to before we move into our breakout activity. Frank asks, is the tool only used at initial intake interview, or do you use it for clients renewing benefits? And Frank, however it is you would like to use the tool, you can use it. You can use it at renewal, you can use it at intake, you can use it at discontinuance, whenever you would like to implement the tool with your families. So I just wanted to throw that out there. And I was really trying to keep Rachel uh, on pins and needles there, but I am going to go ahead and drop the screening tool link in the chat. And I'm also going to drop it in a PDF form in case you prefer it that way. For our breakout activity, you'll be placed in small groups where you'll have a chance to explore the pilot version of the screening tool and think about how it might fit into your county's work. We'll drop the pilot tool link in the chat along with an activity sheet to help guide your conversation. You'll start with a few minutes of individual review and reflection, followed by a group discussion focused on how this tool could support your local CalWORKs and prevention efforts. In total, you'll have 25 minutes, 5 minutes for individual review and 20 minutes for group discussion. After the breakouts, we'll bring everyone back together to share insights and questions. Please identify a reporter to report out at the end of the group activity. Here is your sheet. I'm going to drop the sheet in a Word document. If you decide to utilize this link, then I do need for you to download the link for your own copy. Paste that in there and choose your breakout room. We'll see you all back in about 20 to 25 minutes.
Oh, just as a little addition, if you guys don't know how to get to the breakout room, you can click on the More button at the bottom of your right hand of the screen, and then you'll see breakout rooms listed.
Hi, folks. Welcome back. We'll get started in just a minute with a quick report out to share what you guys talked about in your breakout.
Hey, Melissa, I just wanted to let you know we see the presenter view option.
Oh, you do? Okay, thanks for
Yeah,
letting me know. Let me
yeah,
let
no
me
problem.
work on that.
No problem.
I appreciate it. How's that?
Perfect.
Great.
If only Terry Ann, right? We need a part 2 to a part 10 maybe until we get this thing rolling, right?
Absolutely.
Um, Going to drop the discussion questions for the breakout in the chat just to kind of reiterate. I do believe I should have dropped them in prior, but the conversation was so robust. And I do believe we had a total of 6 breakout rooms. So I'm just going to count down. We're going to start at the top and work our way down. So, who had breakout room 6? And the report out is going to be one simple insight, one suggested improvement to the tool, and one question that you have about the tool. So, breakout room 6.
I see what you did there. I see what you did there. You went with six. Hi, Andrea. So we were in group six, and so the question is, so one implementation insight, is that, so I guess it was a great conversation. I think the counties that were present shared that they want us to get started right away, and are very excited about the tool. Saw numerous ways to be able to begin utilizing it, with uh, there was CBOs with social workers, and they really saw the value of the shared language that the tool provides, and being able to utilize it. And in addition to for participants, and I'm sorry, we said just one, right? So I'll stop there.
Well, thank you for sharing, Miss Anita. Breakout room 5.
That would be me. And if you were in our previous session, you know, I'm not successful at getting anybody else to report out, so I will I will do that. So the implementation insight was about the feedback from the referral agency. So really making sure that it's not a one way, here's some, you know, here's a number, here's a resource, here's a referral, but making sure that we get some feedback that yes, the referral was received and services were offered. So um, that's probably it. Um, we benefited from having Placer in our group, and they should have been running the breakout group because they did a great job of walking us through the tool and answering a lot of questions. And they agreed that they could have had a better feedback process from some of it. They had it from some, but not from all. So, suggested improvement to the tool. Again, Placer, thank goodness, was in my group, and they said that they modified the tool to get the permission and contact information up front. That sometimes energy lags towards the end, and you want to make sure that you have the permission for the warm handoff, um, and the contact information up front. And then the only question that came out of our group was really about um, some of the survey results, how many surveys there were. So a little bit more about the pilot itself. So, yeah, great conversation. Thanks so much to Placer for both piloting the tool and for being in my group.
And for being a part of the Strong Linkages Collaborative.
Yes.
Breakout room 4.
Great, thanks. And that'll be me jumping in, and feel free others to jump in as needed. But I will share each of these. And I got the pleasure of also having Napa County in my room, which was great. And them sharing a little bit about how some of the learnings from their experience, and one of those being really making sure that there's a clear mechanism and structure to reduce duplication, but also make sure that there's this opportunity to leverage the work of other community-based partners throughout the process too. And so One suggested improvement to the tool, some folks had shared um, to that it might be helpful to find a way to ask just a couple of main questions going into the survey itself if they're deploying it, and then maybe leaving some of the other topics within the survey since it is long, leaving some of those to be able to ask about down the road. So maybe modifying the tool to just focus on two key areas that maybe the family might be most wanting to explore or get resources for that day. And one question you have about the tool, I think a really great question came up is how could maybe AI be embedded within this tool or be utilized within this tool to help implement or identify families' immediate needs or resources that they're looking for?
Thank you for that, Derek. This was great and great breakout rooms 3, 2, and 1 get the benefit of this session is having to close. We have to all go back to the main room. So I know that the information from our workshops will be shared via HUVA, via Strategies TA, via the prevention convening. So thank you all for joining our workshop, and we'll see you guys all back in main session.
Thank you, thank you. I thought we had until 3:50, so my bad.
No worries. Thank goodness for these text groups. I got the warning. Please close out all workshops and ask folks to rejoin the main session. So,
Well, we better go rejoin the main session. I'm missing out on hearing from all of you guys about how your breakouts were in both of these sessions, though. So I'm going to look forward to, we need to put together some kind of way to share, but I'll work on that. But we don't want to miss the closeout. So we'll see you guys there.